I am Bob Weedon. That's a picture. I don't know where they got that picture. Who's that guy? 30 pounds heavier, and I hadn't drawn my winter coat. It's kind of hard. I'm not an employee of Arc Sciences, so I don't have one of the really pretty cards. But I have a card if somebody wants my contact information, has questions. So, today, we're talking about how we are changing sterilization with Esterilsol. Changing veterinary medicine with Esterilsol. We're going to talk a little bit about the problem of overpopulation. We know about it in the United States. We're making strides. What was it, 10 years ago we were euthanizing 6 million or 8 million animals a year in shelters, and now we're down to 4. So we are making progress. But in resource-challenged countries, where the dog is the principal reservoir of rabies, human exposure is much more likely. And we found that in the Dominican Republic. The Dominicans' response to a rabies outbreak in a community was to come in and poison animals. Now, as you might imagine, that didn't really sit well with the members of the community. These are community dogs. They're valued, recognized members of the communities. They oftentimes have names. But nobody takes responsibility for healthcare needs like sterilization, rabies vaccination. So the government's response was to come in and just poison them. People were hiding dogs from the government. We went down there, in addition to teaching at U of I and being the shelter vet at Champaign County Humane Society. I work for an international nonprofit organization, the Alliance for Rabies Control. I'm not here officially representing them, but that's how I got involved with international rabies prevention efforts. And we were very successful in Dominican, incorporating high-quality, high-volume spay-neuter, Esterilsol, and rabies vaccination. We changed the way the country approached rabies control. They incorporated animal birth control in mass vaccination campaigns. Very successful. Mexico, Joe mentioned, 20,000 dogs. A lot of experience with the product. U.S. Army Veterinary Corps Pacific Partnership Mission, the U.S. Army is using Esterilsol on some of the Pacific Rim Islands where dog overpopulation is an issue. So tomorrow, United States, doing more with Esterilsol. I have personal experience with Esterilsol, and I would love to see Esterilsol in shelters here in the United States. Why? Well, in the time it takes me to surgically castrate one male dog, and I'm a pretty fast surgeon, I can do 5 dogs with Esterilsol. So it's more efficient. Cost. ASPCA estimates about $125 to surgically castrate a dog. Esterilsol, depending on the size of the dog, what you use to restrain it, chemical restraint, a little xylazine to relax it. It's an alpha-2, so it helps with pain. Non-steroidal for post-injection swelling, probably $25 total. So you're talking a fifth of the cost. Plus, the animals don't have to be anesthetized. You can do a light sedation. You want to reverse the sedation, you can. Veterinary universities adding Esterilsol to their curriculum. I'm going to be teaching it in my shelter medicine course, and my colleagues around the country will be too. The idea is to get it in the hands of responsible people in shelters to chemically sterilize male dogs. Projects going on in India, Bangladesh, Zambia. Esterilsol, like my experience with the Dominican Republic, is being incorporated in rabies prevention campaigns.
So does that mean it can only be administered by a licensed veterinarian?
I can't answer that because I don't know the wording on the package insert. I know that training, and I'll let Joe address that question in just a second, training is very, very important with administration. And I'm one of our trainers, and the biggest mistake people make, the 2 mistakes people make, I'm sure that the majority of people in this room have given vaccinations, right? So when you insert a needle, what's the first thing you do? Aspirate to make sure you're not in a blood vessel. Well, you do not want to do that with Esterilsol because you don't want to pull testicular parenchyma up into the needle because that'll cause contraction of the testicular tissue. And what happens then is it increases pressure in the testicle, And you don't want this material to leak out, because if it gets out of the testicular parenchyma into the subscrotal tissue, it will increase the chance of irritation.
Okay, so it's being administered into the testicle.
It is injected directly into the testicle. I have some show and tell here. The way I've got, if anybody wants to see it, it just looks like a, oops, I'll put that. It looks like a vaccine vial. This is kind of a cool little deal. It's a little caliper. You measure the width of the testicle. I've got a picture of me doing this. And it actually gives you the dose in milliliters. But I'll have this stuff up here if you guys...
To answer your question on the FDA regulations, the insert will say it has to be under veterinarian supervision.
Okay.
But then you also have regulatory rules in different states.
Mm-hmm.
But as far as FDA is concerned, as long as it's under a veterinarian supervision, so a technician, for example, Heather back there is not a veterinarian, Dr. Von Williams, but she has been trained and can do an injection as a technician, so under a supervision of a veterinarian. So that's kind of how it works.
How many of you have heard of the concept of evidence-based decision making? You know, it's defined as a conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients. It de-emphasizes intuition. Well, I think we ought to do it that way. Unsystematic clinical experience. Well, that's how we've always done it. And pathophysiologic rationale as sufficient grounds for clinical decision making, and stresses the examination of evidence from clinical research. I mentioned the 10,000, 20,000 dogs in Mexico. Complication rate was less than 3%. Does anybody know what the complication rate of surgical castration is in the United States? Ma'am? What? Article published in JAVMA about 4 years ago, I think, and I'll see if anybody wants a copy. I'll see if I can dig it up. I've got it on my computer. 4.5%. You know, so it's less, has a lower complication rate than surgical castration. Like I mentioned, less expensive, much more efficient time-wise, and you don't have to put the animal under anesthesia. Yes, ma'am.
Have studies been done in long-term to view long-term complications?
Have studies been done long-term to view long-term complications?
Been about, well, it's been 15 years, 18 years, and there have been none because the complications, we haven't had any long-term complications, and there's none recorded at all. We've had dogs that have been done for years. Yes.
Are there side effects? There are side effects. They're very mild. Typically, the most common side effect is transient swelling for up to 3 days post-injection, where the scrotum and testicles will swell slightly, which is why we recommend the concomitant use of a non-steroidal anti-inflammatory to help with that. That's very minimal, but it's exacerbated by leakage of product out of the testicular parenchyma into the subscrotal area. And I mentioned there were 2 ways to prevent that. One was not aspirating. The second way is when you inject, and I'll have a picture here in just a second of me injecting a dog, but you inject very slowly. When I was training veterinarians and veterinary students in the Dominican, you know, sing happy birthday, count to 6, whatever. So it's given over a slow, steady period of time so you don't increase pressure in the testicular parenchyma. And then when you're done injecting, stop and count to 3 to allow that pressure to equilibrate in the testicular parenchyma before you withdraw the needle. If you follow those guidelines, virtually side effect free. Now, if it does leak out and the dog licks, then you have to put an e-collar on, because they will lick and self-traumatize from the irritation. But you're a veterinarian. I'm sure you've seen dogs lick their neuter incisions too. So, I mean, dogs lick their wounds. If it hurts, they'll lick it. I saw a hand up over here.
I was just wondering, how long from the time of injection does it take effect?
The animals, histopathologic studies have shown that within 30 days, they are virtually 99.6% sterile.
So they could actually, if you release them from shelter and to adopt a family, within a week or 2, they could still get pregnant.
That is possible because there could be sperm in the epididymis. Now, you know, one of the big questions is what effect does this have on testosterone? You know, and the Mexico studies have shown that it decreases circulating testosterone 40 to 60%. Is that enough to reduce the behavior of wanting to breed? During that period of time, yes, but that's a very good point. You know, if you did a dog today with Esterilsol and adopted him on Monday, he would still be fertile, yes, sir.
Depends on the age too.
He does?
Yeah, I believe it's the age. If it's already a sexually active dog, it's different than if it's a puppy.
Yeah, the scientists who really
they're gone quickly.
Yeah.
They're
puppies. She was first, and then I'll come back to you.
What physiologically happens to the testicle? Do they still have some sort of function?
It causes fibrosis of the seminiferous tubules, so they don't function. It essentially kills the sperm-producing capacity of the seminiferous tubules. Has a lesser effect on the Leydig cells, so they still do produce some testosterone, 40 to 60%.
When she asked about long-term, I mean, is there any concern with the testicles becoming cancerous? Like they would if they were...
Actually, just the opposite.
If you know, like if a dog has a undescended testicle,
Right.
and it sits there, and one of the risks is that it can become cancerous.
But why is there more of a risk?
I don't know. That's
because it's at body temperature rather than in the scrotum below body temperature.
Okay.
So basically, it kills the seminiferous tubules. So causing fibrosis of that, they're not functional. They're not. I don't see how physiologically or pathophysiologically they could become malignant, but certainly Leydig cell carcinoma does occur, and that's possible, I would suppose, because Leydig cells are still functional. But the reality is, I think the incidence of something like that's very low. I don't know that it's been looked at, but I'm just kind of theorizing based on that. I'm going to get in touch with Carlos to get more specific answers, because that's a very good question, and that's a lot of people express that concern. And I'm going to talk to the veterinarian in Mexico who's got much more experience with it.